If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, how do you prevent juvenile diabetes? Answer by Gerardo Carlos Melendez. Juvenile diabetes has traditionally been considered to be either type 1 diabetes or one of the other specific types of diabetes, termed globally, MODY, maturity onset diabetes of the young. However, in recent times, there has been a dramatic increase in type 2 diabetes morbidity in juveniles. I will try to give a basic explanation of what is the difference between each type and then how it can be prevented or delayed. Type 1 diabetes is an autoimmune disease. The individual develops antibodies that target proteins, ion channels, enzymes, that are specific to pancreatic beta cells, thus calling in the immune system to destroy these cells. Therefore, type 1 diabetics usually have a complete or almost complete insulin deficiency, for insulin is only produced in those cells. Type 1 diabetics depend on exogenous insulin to survive, or else, they would starve. Type 2 diabetes is by far the most common type of diabetes. It has a strong genetic influence and is usually presented during adulthood. However, the average age for diagnosis is rapidly decreasing. The main pathological mechanism of type 2 diabetes is called insulin resistance. When the body is chronically exposed to high insulin levels, such as when a person continually sips soda all day, every day, or consume any other high-calorie food constantly, skeletal muscle cells and other cellular types will become resistant to the effects of insulin, thus making it ineffective in causing high blood sugar, weight loss, lots of hunger, the cells can't absorb glucose and are lacking fuel, and lots of urination, due to the osmotic effects of high blood glucose in the kidney. All of these are also evident in type 1 diabetics, and are diagnostic symptoms. The first line of treatment for type 2 diabetes is lifestyle and dietary changes. If this fails, metformin is prescribed, because it does not cause weight gain, unlike thiazolide and edionase, which can be used if the patient has lost weight and is controlling his diet. Now, MODY is actually a group of rare, independent mutations in the genome controlling beta cell growth, proliferation and metabolism. These mutations, in general, weaken the beta cell's response to glucose, and in this manner, limit the amount of insulin that is either produced, released, or both. Most MODYs respond well to treatment with sulfonylureas, which activate the insulin release signaling pathway. How can they be prevented, do you ask? Well, that depends on what type of diabetes you are most likely to present. If type 2 diabetes runs strongly in your family, you should begin to monitor your blood glucose, and if you are overweight, change your lifestyle immediately. Diabetes is like a ratchet, it only moves forward, not backwards. Most of the time, stop it before it happens by lowering your carbohydrate intake and exercising. Exercise decreases insulin resistance by increasing the AMP/ATP ratio in skeletal muscle cells, which activates AMPK, an enzyme in charge of the metabolic needs of the cell. This enzyme upregulates GLUT receptors, the opposite phenomenon to that present in insulin resistance. Type 1 diabetes is much more difficult to predict and prevent. It does not have such a strong genetic weight as type 2 diabetes, and the onset can be much faster and hard to detect. There have been several studies linking type 1 diabetes to highly developed countries where hygiene is very good. This is known as the hygiene theory, I believe, and it's based on the fact that the human body is a lot more capable of regulating antibody production when it is exposed to many antigens during childhood, which can happen more easily when less hygiene is enforced. In other words, the body can more easily overreact if it has not encountered many different antigens before, perhaps because it is still immature and trying to produce many different antibodies. The problem comes when an antigen that is very similar to a human antigen is presented to these cells. They can overreact and produce autoantibodies, which can cause a very wide range of diseases, including diabetes type 1. As for MODY, there really is not much that can be done. It is monogenic, which means it follows Mendelian inheritance patterns, which can make its prediction easier, but prevention is difficult. The mutation can't yet be modified and usually leads to progressive diabetes. However, MODYs are usually rather mild and very easy to treat, not cure though. So there you go, a rather lengthy post for a rather important disease, which has many variants, as you can see. And don't even get me started on how many diabetics are not being correctly treated and sometimes receiving high doses of ineffective medications for their diabetes subtype. Even within only a single type, MODY and type 2 suffer this the most.